you'll notice we use the term consumer quite a lot in this discussion, and that's just the term used within the health industry to refer to women who use maternity services. We'll generally use the term woman or women in this discussion, but we do acknowledge that not all people who give birth identify as women. So first on our panel, I'm going to introduce Alecia Stains. She's the director of the Maternity Consumer Network, which is a consumer advocacy group. So Alecia, can you tell us a little bit about your experience with home birth and how long you've been involved in advocacy?
Yeah, I've been in advocacy for nearly 10 years now. I started mainly in Queensland, or doing local area stuff around trying to access more continuing midwifery carer. I've had 2 home births in 2019 and 2017, and I'm a classroom teacher. I do have a business that teaches childbirth education and yoga, but I spend a lot of time in this space doing advocacy so that we can move towards more evidence-based care and supporting what women want to access. And like, as we're aware lately, there's been a huge demand for home birth that isn't being met for a range of reasons. So I'm pleased that everyone's organised this discussion for a range of reasons.
Thank you. Okay, I'll go over to you now, Teresa. Teresa is on the board of directors for the Australian College of Midwives. Can you just tell us a little bit about yourself and your role at ACM?
Yes, hi everyone. My name's Teresa Walsh. I've been a midwife for 35 years and I'm also a national director of the College of Midwives for the last 3 years. I'm a private practice midwife in Queensland and I've had 2 home births myself. So yeah, I feel like I've got a lot of experience to share. Yeah, so the role of the directors of the college, they're elected by the membership. So there's 5 midwifery directors, and the president is also a midwife, and then there's 3 community directors. And the role of the board of directors is to provide strategic direction to the College of Midwives. So yeah, that's my role within the college.
Okay, thank you. We've also got Jo Hunter on the line. She's a midwife in private practice located in the Blue Mountains in New South Wales. Jo, can you tell us a little bit about yourself and your history of advocacy?
Yeah, sure. So I started my journey in birth work from a consumer perspective. So I had home births myself 20 odd years ago, and I was the coordinator of Homebirth Access Sydney and the president of Homebirth Australia for many years. Very involved with getting Medicare up and running for home birth. And I sort of moved from there into private practice, I did a Bachelor of Midwifery, and I'm now a midwife in private practice. I've been practicing for 10 years now as a privately practicing midwife. Yeah, that's how I've kind of got here.
Thank you very much. Okay, I'll just touch on the topics we're going to be covering today, and I'll cover them in order. We're going to talk about professional indemnity insurance for privately practicing midwives. We're also going to talk about Medicare rebates and some changes that consumer advocacy groups are working on at the moment, and also some of the barriers facing privately practicing midwives. So just a bit of a background for those who aren't aware of the whole insurance issue. In Australia, AHPRA, which is the regulatory body for health workers in Australia, requires all healthcare professionals to have professional indemnity insurance for all aspects of their practice. And for privately practicing midwives, this includes intrapartum, which is labour and birth care, which is often provided at the woman's home. There is currently no such insurance product available for privately practicing midwives in Australia. So back in 2009, an exemption was put in place, which was extended in 2013 and again in 2016 and 2019. So this exemption allows privately practicing midwives to attend home births without that insurance cover for the labour and birth period. The latest exemption is due to expire in December next year. And so once this runs out, privately practicing midwives will no longer be able to legally attend women to birth at home in Australia. So it's for that reason that Homebirth New South Wales believes that an insurance product is necessary to protect midwives and women and legitimise home birth in the public view as a safe birth option. Every time we go on the path of repeatedly extending the exemption, women are left in this sort of limbo, not knowing. If you fall pregnant, say in July next year and the exemption runs out in December, you're kind of left unsure whether you're going to be able to have a home birth or not. So women need certainty around their birthing options, and the future of our privately practicing midwives, yes, darling, businesses and livelihoods hang in the balance. So I just want to ask, first question of you, Jo, why is this insurance product so important for midwives?
Well, I suppose the first reason is that we are the only registered health professionals in Australia that aren't covered by professional indemnity insurance. And of course, that means that every time we leave our home in the middle of the night to attend a birth, we're putting ourselves at risk. Obviously, you know, working as a privately practicing midwife, we're working with women who are very well informed and making informed decisions themselves. And, you know, because we're working with normal physiological birth, it is actually quite low risk in terms of things going wrong. But, you know, sometimes things don't go as planned and, you know, through no fault of anyone. But, you know, if a baby or a mother is damaged during a home birth, there's no repercussion for her to be able to say, okay, you know, I might need help raising this child or whatever. And there's no insurance that can cover for the midwife and the mother, and which means the midwife can be sued and she has no cover. Therefore, she could lose her home, her, you know, her savings, her livelihood. So that's the biggest reason. Obviously, there's also, you know, the fact that we don't have full legal support as privately practicing midwives without insurance. So right now, MIGA insures us for antenatal and postnatal care. So if there is a case that's against any midwife, they won't offer legal support in terms of a lawyer to support us if something happens during birth. If something happens during the antenatal period or the postnatal period, then they'd help, but they can't actually give us legal support because they're not giving us insurance for that part as well. So that's another reason why it's important for midwives to be able to access professional indemnity insurance. What else have I got written here? I mean, they're the main ones, really. I mean, obviously, for women as well to be able to access midwifery care. I mean, if the government don't give us another exemption, like you said, then we can't register without an exemption. And you know, it seems that every time there's another exemption put in place, more things are added to the safety and quality guidelines that we need to follow in order to be exempt from the professional indemnity insurance. I don't know whether that's been covered anywhere, but it's a pretty large document and it keeps being added to every few years of things that we need to do to jump through the hoops. And we continue jumping, but there doesn't seem to be any solution to the problem.
Yeah, we're going to touch on that a bit later on too, about the issues and the hoops that midwives have to jump through. Alecia, from a consumer's perspective, what are your thoughts on the professional indemnity insurance issue, and have you had any concerns raised by consumers about a potential product?
Well, as Joe mentioned, like, I guess it needs to happen, because if something was to happen to a woman or a baby, that you want to be able to have that avenue to get compensation, regardless of, you know, if there was no fault. So that is one issue. I guess on the flip side, as you mentioned, like, some concern is, will it narrow the choice that consumers have even further, because we are talking about, like, insurance. So, you know, there's more hoops to jump through. And that too is the cost. Is the cost of home birth going to become even more unaffordable? Because at the moment is very much like white middle class women who can afford it. And our goal is for it to be accessible to a lot more women, not just affordability, but also if we could get more private midwives through a range of things like reducing red tape and things like that, like increasing access. Particularly I find like regional women, rural women, there is such a limited choice for them that they're often having to relocate.
Mm-hmm. Yeah, I was going to ask you as well.
Sorry, can we just add something there? It's also one of the concerns, particularly with rural midwives, is having the problem of accessing or securing a second midwife for the births, which is part of the quality and safety framework that we have to follow to be exempt from insurance, is to have 2 midwives at every home birth. And, you know, I know that some of my rural colleagues have real issues with that, and therefore reducing, like Alecia was saying, reducing access for women. And, you know, we know that women are coming to more regional areas and hiring Airbnbs so they can have their home births.
Yeah, and especially during, you know, COVID, I've seen online a lot of women talking about, you know, taking out loans or, you know, things like that.
Accessing their super at the moment. Yeah,
just to be able to afford a home birth. So Joe, apart from that you've just mentioned, what other concerns have you heard amongst midwives about an insurance product? What are some of the things that they're concerned about or you're concerned about, and how it's going to affect your practice?
Yeah, I mean, I actually asked around some of the midwives before this meeting just to see, because obviously I've got my own opinions, but there's plenty of other opinions out there. And it seems like the biggest one is the cost, obviously, because, you know, it's already $7,500 a year just for antenatal and postnatal insurance. So, you know, if you're going to add birth insurance onto that, what's that going to look like? And, you know, privately practicing midwives are by no means in the money. You know, we don't service the sort of numbers of women that private obstetricians do. So where's that going to come from? You know, will it then be put onto the extra money that the women are going to have to pay in order to cover it? So that's concerning. There's really big concern around insurance companies governing midwifery practice, and we already know it does. I mean, you know, in terms of insurance now, like before, when we had Vero insurance as well as MIGA, Vero was insuring non-Medicare eligible midwives, which meant that midwives didn't have to do the whole 3 years post-grad before they could start practicing as a privately practicing midwife. And now, because MIGA only actually insures Medicare eligible midwives, it means that privately practicing midwives who have just graduated can't go out into private practice. So that's really concerning, because we know that you know, our population of private midwives is getting older, and it'd be nice to have the next generation coming through and having some sort of support system where, you know, midwives can go straight out into private practice with the support of a more experienced midwife. And as it stands, they can't, and, you know, they're sort of stuck in the system for 3 years, which is a real shame, or 5,000 hours. There's also big concern around removing autonomy for both women and midwives. So around, you know, what the insurance company will insure and what they won't. You know, will we be able to still attend women that are planning vaginal births after cesareans? You know, or anyone with the slightest sort of risk factor, is that going to be off the table? they're the main ones that I've been hearing and talking to other midwives about that are the concerns.
Yeah, they all sound familiar to us as well. So the Australian College of Midwives has been working with an insurer on developing a suitable product for privately practicing midwives. And we're very grateful to Teresa for joining us today. Teresa, I've got a couple of questions to ask you about this potential insurance product. So first of all, how soon do you know if this product will become available?
Okay, thanks. Well, there's a couple of things. The college have been working on this for a long time, but more intensively recently. It's actually, from a development perspective, it's pretty well ready to go. But what's holding it up is, of course, it's not the college's decision. This has to be, in order for it to be a practical, useful product for our profession. Obviously, it will have to have similar arrangements with the government as the MIGA product does. So it's actually up to the government when they allow this to happen. And of course, what you've said about the history of the exemption is quite true, that when it was initially set up, one of the issues with the expiry is that each time it expires, as Joe rightly said, it's always like an 11th hour decision to extend it again because there is no product available. And then safety and quality guidelines are sort of added to, which is quite right. But the issue is that the last time we got the extension last year, what happened was, as usual, they said there won't be another extension. They've said that every time. But what they said was that what needed to happen was that the state governments, the COAG essentially, the Council of Australian Governments, needed to get together and find a solution. And so that was what was the outcome of that last extension to the exemption. And so that project was actually handed to the Queensland State Government, and I guess you guys are aware of that. Like a lot of things, you won't be surprised to hear that this has not been given priority in 2020. So they were supposed to come up with a solution by midway through 2020. And of course, COVID has sort of pushed it off the agenda. So the college is very active in this space in terms of its communication with the federal health minister and the federal, that whole, so like there's the chief nursing and midwifery advisor, there's the health minister, there's the assistant secretary of the MBS, all of those people. But in fact, they're all saying, you know, it depends on what's coming out of this COAG process. And that's sort of on the slow burn, I guess, because of COVID. So we don't actually know what's coming out of that. But in terms of the actual product, as far as it's kind of in the development phase, what the college has done is basically tried to set up a system so that the profession can actually have carriage, if you like, of this product, so that we can demonstrate, set up an entity that demonstrates that the PPMs who are being insured are actually best practice PPMs, sort of thing. So trying to include the quality assurance with the product so that it doesn't get kind of handed over to some other entity, for example. So so yeah, that's that's sort of a roundabout way of answering, of talking to you about the product, but it is very much on the agenda for the college, but COVID is, you know, slowing things down.
Yeah.
Mm.
Thank you for that. So on the topic of inclusion criteria, and this is in relation to the women themselves, one of the concerns among consumers is similar to publicly funded home birth programs. The selection criteria can be quite tight. So high risk women aren't eligible for those programs. What will the inclusion criteria be for the product, and is it likely to change later on?
I don't have those details because they're not actually published anywhere yet. But I share the concerns of the rest of the profession that it's almost inevitable that the insurer will be the one who makes those decisions. So that's why the college has tried to keep hold of basically assuring the insurer that the midwives that have access to the product are quality midwives who have demonstrated, not necessarily in terms of years, but are willing to participate in quality assurance procedures and so forth, so that the public, as you say, but also the insurer, can be assured that those midwives are participating best practice. But it is almost inevitable, I believe, that risk will certainly come into it. There's no doubt about it. I mean, we've already got the safety and quality guidelines, the consultation and referral guidelines, which are determining a lot of women's access to the type of care they want. And I believe that it's bound to be similar. So that's one of the concerns that we have at the board level, is that although we understand the desire and the need for insurance product, it is a concern that it may well limit some women's access to home birth. I think it's almost inevitable, certainly for high-risk women.
So just touching on those, Joe alluded to those guidelines as well, that each time an exemption is extended, midwives are required to do more and more to prove that what they're doing is best practice and safe. Is it likely that this insurance product will require them to do less, more, or the same of that kind of criteria? So will there be less hoops for them to jump through, or more?
That's a good question. I think it's likely it will be very similar to what it is now. Mm.
Okay. And so I think something you said led me into the next question. I'm just trying to find it on my list. Sorry, it was something to do with which midwives will be able to access the insurance. Only those with specific training, or practicing for a certain number of years? Do you know of the criteria that midwives need to meet?
No, again, those specific things have not been determined or published yet, but there will be a quality assurance process to go through in order to access the insurance. As I said, it won't necessarily be a number of years of experience or anything like that, but there will certainly be quality assurance, and the college hopes to be able to keep carriage of that, so the profession actually can keep, rather than the insurer. Do you know what I mean?
Yeah.
So that's what our product is aiming to do, is to be it won't mean that non-members can't join or anything like that. That's not what I'm saying. It's just so that the college is really aware of the issues that women are having, trying to access, and also the restrictions that are on midwives, and hopefully it won't be seen as another barrier. That's my hope anyway. But there will certainly be a criteria. There will be criteria for accessing the insurance, inevitably. What I'm worried about, and and I agree with all the things that have been said, is that my concern is that regardless of who has carriage of the product, there will still be some women who midwives may not be able to attend, particularly if they do have a lot of risk factors.
And we know that's the case now already. There are some circumstances where PPMs can't attend home births at the moment. I guess the concern is just whether they will be tighter than they are now among consumers.
Well, in fact, can I just, as a matter of fact, at the moment, PPMs can attend women who have risk factors, because they have they can use the Appendix A in their record of understanding, so that they can clearly express that they have recognised the woman's risk factors, and the woman also has clearly expressed that she has her risk factors, but they've agreed to provide her care anyway. One of the concerns about losing the exemption is that won't happen anymore. It'll be the insurer who determines. So the woman and the midwife together won't be able to have that discussion and make a plan together to keep her as safe as possible and respect her wishes. That won't happen anymore, because the exemption will be gone. So unless we fit in with the insurer's criteria, that's my concern.
One would hope,
it's a genuine concern.
One would hope that the College of Midwives consultation and referral guidelines would be guiding what the insurers are saying is okay to be doing.
Well, at the moment, you see, we've got the consultation referral guidelines, and we've got the exemption. So therefore, it's possible. But what concerns me is that when there's another layer, when there's an insurer involved who has commercial interests and all of that sort of thing comes into play, it will be. I don't think it will. I think there'll be more to it than just being able to complete an arrangement with the woman and still access the insurance. That's in cases of, I can't say specifically what for, but for really, women who have multiple risk factors, it may be more difficult.
So throughout the consultation process with other privately practicing midwives and with consumers, with the ACM, hopefully there'll be, even if it is the case that we can't access the insurance, hopefully it will mean we just can't access the insurance, but still be able to support those women without the insurance.
I doubt it.
Right. Well, yeah.
I doubt it, because the thing is the exemption, Jo. While we've got the exemption, we're okay. But the government clearly intend to finish the exemption, and it's dependent on insurance. So that's the issue. Once the exemption's gone, midwives will not be able to, if they if they can't access a woman, if a woman can't access their services for reasons which are concerned with insurance, then the midwife actually won't be insured to provide care for that. And that's all the exemption is. It just allows her to provide care without insurance.
On the topic of consultation, Teresa, do you know if ACM plans on doing any broader consultation with midwives to get their input about this product? Because I know not all PPMs are members of the college. So how will we capture the concerns and feedback of all the people who'll be affected by the product?
Well, I mean, if there's an interest in it, then it's really up to them individually to, or as groups, to make representations to the college, because it is an ongoing project that's going on at the college. Sorry, excuse me.
That's okay. All right, so I might move on to cost now. So one of the concerns we heard before was that it might be more expensive for midwives and therefore for women. Do you know roughly, in comparison to how much midwives currently pay for the MIGA insurance, how much more expensive this product will be?
Okay, so the aim of the college is that it won't be more expensive than the MIGA product, and that's the proposal that we have put forward. Obviously, at the moment, it's what we need is a commitment from the government that they will offer the same sort of support to this insurance product as they do to MIGA, and that's an unknown. So at the moment, midwives that have the MIGA product, it's heavily subsidised by the government. So although we pay $7,500 a year, if it was up to the insurer, if it didn't have that Commonwealth subsidy, it could be much, much higher. So we will need to make sure, and obviously that's one of the representations we're making all the time to government, is that we need to ensure that is maintained for an alternative product.
Yeah, that was another one of the questions that we had. My understanding is that the government subsidises insurance for obstetricians and GPs. Will they do the same for this product? Was another one of our questions.
Well, that's the goal. I mean, they do subsidise the MIGA product, so it would be our intention that they would also offer the same subsidy for this product, for this alternative product.
And this alternative product will replace the one that MIGA currently offers, so it will cover the before, during, and after birth period, or is this just for the labour and birth?
No, the product that's being developed is that it will be comprehensive. It will be a fully comprehensive product, and include home birth, intrapartum care at home, which is the one bit that's missing out of the MIGA product.
So for some midwives, say the product becomes available and there's an overlap between the time when they have the MIGA insurance and this new product. They may be paying extra for that period of time. Are there any plans for the government to cover that overflow cost to make it feasible for them, or is that something the college plans on taking up with them when they start discussing it?
Yeah, that's one of the things that's in discussion all the time, because we do know that once everybody who has insurance with medical indemnity insurance, even when you stop practicing, you have to keep paying the runoff cover. So we obviously know that that's going to be an issue for the midwives who currently have MIGA. Many of them may be happy to continue with, not all midwives are providing home birth services, so they may be happy to continue with the MIGA product. Some midwives, if this other product does become available, then we're anticipating that midwives that are providing home birth services will want to use a product that includes home birth services, so that they can stay registered and keep providing home birth services. So that's one of the issues. I mean, I guess that's one of the good things about having me on the board, is because I know all that, and I can always be saying, this is an issue for privately practicing midwives. They already have this cost. And they'll have runoff cover from this, and then how will that be dealt with, if this other product is developed? Yeah, I unfortunately I don't have an answer for you, because we are really in a holding pattern at the moment, waiting for some feedback, I guess, from COAG and from the Federal Health Minister.
So, and it's good that this is happening now, I suppose, because if anything new comes up that isn't already on your agenda, you can present that, when the time does come to speak to the government about. Do you know whether this product, so cover birthing at home, but what are the complications if a woman transfers to hospital? How does it work with the current cover that midwives have? I've got here a question saying some hospitals require their own product for a PPM. I'll read it in full, sorry.
Yeah, okay.
Does the intrapartum home birth product also cover transfers or planned hospital birth for all states, as some hospitals require their own product for PPMs?
Well, I'll try to answer it as best I can. The problem with intrapartum cover at hospital has always been the admission status of the woman. So it's quite, it's a long story, but essentially a woman who is admitted privately to a hospital with her private practice midwife, that private practice midwife's insurance covers all the care that's provided. If, however, the woman is admitted publicly to a hospital as a public patient, the midwife's insurance doesn't cover, is not active. It doesn't work at all. And then the hospital have their own insurance cover. And that's why it's always difficult if a PPM needs to transfer into hospital and doesn't have a visiting access arrangement at the hospital, then she can't actually provide her care any longer. She can only be a support person in the hospital, because if she provides clinical care, there's no insurance cover, and therefore, she's at risk of being of losing her registration. So it's a little bit complicated. So the new product, so MIGA covers all of everything apart from intrapartum care at home at the moment. So it covers intrapartum care in hospital as long as the woman is admitted as a private patient under her midwife. So the midwife has to have visiting access arrangements and with that hospital. So it would be a similar situation with this if this new product was covering all of what MIGA does and home birth, then it would be a similar situation. You still wouldn't be able to admit a woman as a public patient and provide care in a public hospital, because there wouldn't be any insurance arrangements. Does that make sense?
I think so. Hopefully it answers. That's a question from a consumer, so hopefully it answers that for them. But it does. I mean, I'm not across all the complexities of when does hospital cover the woman, or when does the private midwife. So
I mean, there must, Queensland is the only state that doesn't have any publicly funded home birth. So all the other states have one or two small publicly funded home birth models. So there's obviously an insurance product that the state hospital service can access to cover that service, but it's just not available. It's not available to PPMs.
Because they're technically not hospital employees.
Correct.
Yeah.
Correct.
Yeah.
So there is talk of maybe setting up some sort of public-private partnership, but all of that is just talk at the moment. There's no established sort of format like that, and certainly not in Queensland.
Okay, I might move on to, we've got a couple of questions about the claims process. Sorry, before I get on to that, so we touched on, Joe touched on the fact that in 2017 it became a requirement for 2 PPMs to attend a home birth. Do you know whether both midwives will require this insurance product? So both the primary and the secondary midwife, or will it all be covered by the primary midwife? By her cover?
That's an interesting question, and I can't answer it because I don't know, to be honest with you. But it is an interesting question, and one that I will certainly consider, because as Joe would know, and as many people would know, the second midwife is not always a PPM. Sometimes, particularly in rural areas, it might be a midwife colleague of the PPM. And at the present time, under the safety and quality guidelines, the second midwife doesn't have to be a PPM either. They can be. There are sort of rules around it, as there are with everything. But the second person attending, the second midwife, doesn't necessarily have to be a PPM. It can be a midwife. So that is built into the safety and quality guidelines at the moment.
Yeah, that leads into another question. Student midwives. So, yeah. Okay, so I'm assuming they will have the same rules apply to them.
Well, some universities provide insurance for their student midwives to attend home births. Not all, but some do.
Okay. Okay, so a couple of questions on the claims process. One thing we wanted to ask was if a woman under a midwife's care makes a claim and that affects her premium, will the price go up for all of her clients then? How will that affect the pricing?
I don't have details like that because we haven't even got an agreement that this is happening yet. As I explained, it will certainly be our goal that the insurance product will have the same amount of government support as MIGA currently has, and the MIGA product is capped at a particular level. So when you apply for the MIGA insurance, you tell them what your income is, and essentially that determines what your premium is. So it will be the goal of this product to have a similar arrangement. So yeah.
So say you've got with privately practicing midwives, some of them, most of their clients are home birth clients, whereas some you have, you might have a midwife who only does a handful of home births a year. Will the pricing be based on the number of clients that midwife sees per year? Or, I mean, this is an insurance product that is not just specific to home birth. So I guess it's a difficult question to answer, but we're just trying to establish whether it's going to be the same cost for all, and you've got a midwife who only does a handful of home births a year, is she going to be paying a lot?
Okay. Yeah. It'll be, I imagine it will be similar to what MIGA is, and MIGA, it's dependent on income. So the minimum there's 2 levels of cover that MIGA offer. One is antenatal and postnatal only, and one is antenatal and postnatal and intrapartum care in hospital. And then the premiums are determined by what the midwife's income is. So you can buy insurance for example, if the minimum that level of insurance that you can buy from MIGA, which covers everything, antenatal, postnatal, and intrapartum care in hospital, it works out to about $2,500 a year, and the maximum is $7,500 a year. And there's I think there's 4 increments. So yeah. So it would be. It might not be exactly the same. I'm not saying that because I don't know. But the goal of the college would be that we would have a similar price for the midwives, because we don't, we're well aware that, private practice midwives are not, are not earning, huge amounts of money that they would be able to pay, large insurance premiums, and we don't want that to be passed on to women either.
No, we don't. Thank you. All right. We might, before we get touch on any of the questions from people watching on Facebook Live, I might move on to our next topic, just in case we cover some of those questions anyway. So, Alecia, I just wanted to talk to you a little bit about the Medicare reform, Medicare reforms that you've been working on with MCN. Can you just tell us what those changes are and what they'll mean for consumers?
Yeah, so in 2018, hey, I'm just online. So in 2018, the Federal Health Minister, Greg Hunt, basically tasked the department to review all of the Medicare item numbers, and participating midwives was part of that. There was a small committee formed, so we reviewed all of the item numbers. As far as how it will impact home birth, most people, so this is public, the recommendations, there were doctors, midwives, academics, and consumers on that, but it's very public knowledge that some of the recommendations were to receive Medicare rebates for intrapartum at home. Now, because of COVID, nothing's really happened, or particularly at the pace that we would like to see, and we've had, a very coordinated effort with other organisations around trying to get some traction on that. So the committee I was on, that report then has to go up to the Medicare task force, which oversees all the reports. Unfortunately, it came, it was bundled amongst allied health and also the nurse practitioners. Now, a midwife's scope of practice is a midwife's scope of practice. Like when we're comparing it to nurse practitioners, it's an extended scope of practice. So that was an argument in itself that we shouldn't really have the participating midwife report bundled in to try and get commonalities with nurses, but this stuff happens all the time. So obviously had plenty of talks with the department and things like that. We also tried to get some temporary item numbers because the demand for home birth was huge and is still ongoing, quite high because of COVID. And I think great, women are looking at more options, but it also, I guess, highlighted how quickly the systems will move away from evidence rather than support it, because we know that women were wanting to access home birth because they were limited in their support and, couldn't access a range of things which they could actually access at home. Yet there was still a lot of barriers or not a lot of movement or support in trying to get home birth more accessible, because we know that the cost of home birth, and it's not a reflection of what midwives are earning, but the cost of home birth, because of the low rebates, is a huge barrier for consumers. So I'm kind of hoping, I've been doing a lot of advocacy around that in a federal space, that we hear soon about the recommendations and whether they've been accepted. And then from there, usually, you know, it's like committee after committee. So then there'll probably be an implementation committee. And so that's where we're up to with that.
Thank you. Okay, so I might save that question for the end, actually, and I'll move on to Jo now. So, Jo, in our last couple of Q&A webinars, we touched on the increased demand for home birth due to COVID. Can you tell us about your experience? I know you've been getting a lot of inquiries from people who hadn't previously considered home birth, but the restrictions in hospitals are, you know, and a couple of other things are making it a more attractive option for them. Can you tell us a little bit about that and your thoughts on making home birth more accessible?
Sorry, to unmute myself. There's definitely been a huge increase in both inquiries and bookings for home birth, and that's certainly within all the midwives that I talk to and work with. There's about 10 of us that support each other, and we're all completely booked out until May next year. You know, we're finding that it's continuing. Like, obviously when COVID first hit, you know, we were getting, I mean, I was getting 20, 30, 40 inquiries a day there for a little while. But even so, it's definitely making women think about other options and for the future as well. So, you know, women that are calling now that might necessarily not have chosen home birth before are definitely thinking about it now, because, you know, I mean, obviously the restrictions in the hospital are concerning. You know, women are only being able to take one support person, and then this whole idea of in Victoria not being able to birth in water and all the other things that have come with COVID. So yes, it's definitely a huge increase. I think way more than I would ever have expected. And I think the only way that we can really move forward and be able to support all women is to try and get some sort of funding for the actual birth component, which Alecia, I know Alecia and MCN and Maternity Choices Australia have all been working on really hard. So yeah, I don't really know what the answer is. We need more midwives working in private practice, and in order to do that, I think we need to get insurance that covers midwives to go straight out into private practice, like they do in New Zealand. I mean, in New Zealand, midwives are educated to go straight out into private practice, and they do with the support of more experienced midwives. And I think if we can get that, and then Medicare, then we're away, really.
Yeah, I was going to ask you about the paper you've just published about the experience of privately practicing midwives who've been reported to AHPRA, because that's another one of the big barriers that PPMs face, and I think that contributes to people leaving the profession, definitely, but I can see it would be a big turn off for new midwives entering private practice as well. I might just notice the time, so I might hold off on that one just for now, so I can cover some of the questions that people have been asking. So we've got a couple of questions about the runoff cover. We don't want a product for PPMs that enforces the same rules as with publicly funded home birth programs. That's just a comment from somebody. There's a lot of concerns about the increase of free births. If this product was to be more restrictive to women than you know, or provide more roadblocks to them than they currently face. So at the moment, Teresa mentioned it's basically up to the PPM and the woman. If she has, you know, if she's a high risk, it's up to them to take that, you know, if they want to risk, you know, the midwife wants to provide home birth services.
Too, we need to be clear that some women, like, we don't want to throw them under a bus, that some women actually want a free birth. So we need to be specific that the women that we're actually speaking of are ones who want a home birth but often get risk out of it or don't have access to private midwives. And they're the ones that the comments are referring to, not that we don't support bodily autonomy in women deciding if they want a free birth, they can pre-birth.
Yeah, absolutely. Of course. So, yeah, I think that is what the comment is referring to, that those who prefer to have a midwife present are either not going to be able to afford it, or they may be risked out and have to free birth, not by choice.
That's concerning for me, in that, you know, the women that would otherwise be risked out of the services that we currently provide are the very women that probably really need to have midwifery care, and want it, obviously. I mean, like Alecia says, there are plenty of women that free birth and that's their choice. But if they're doing it from a place of not having any other choice, particularly with risk factors, it's really, really concerning. And it should be something that us as midwives and the College of Midwives and the government should be taking very, very seriously.
Yeah, absolutely. We should be making it as accessible as possible, because, you know, we know that a lot of women who go through the hospital system, you know, it's 1/3 of women who give birth report having a traumatic experience, and that's also a big driver, to women choosing to birth at home. And especially with COVID, you know, you mentioned the one support person rule. Women with families and other children don't have the option of taking them all with them to the hospital, and so on. So one other comment, or actually it was a question, I'm just trying to find it here. It was about midwives who choose, what will the consequences be for a midwife who chooses to continue to service women who are high risk, who won't be covered by the insurance? I guess that one's for you, Teresa.
Well, if we don't have an exemption, then she will risk losing her registration as a midwife. That's the whole problem is the exemption actually is great at the moment, because it means that there is that capacity for midwives to work with a woman, and you know, using the Appendix A of the consultation referral guidelines to work out a way that she can provide safe care, and demonstrate that she's providing safe care. Midwives are providing safe care, but it's actually having some way that they can demonstrate they're providing safe care. And the exemption allows that, because they don't have to have insurance. So, you know, it is allegedly the intent of the government is to get rid of the exemption, which on its own is a problem. Even without the insurance factor, that's a problem, because at the moment that is allowing that capacity for midwives to provide care for women who don't fit into what everybody thinks should be what they look like. Do you know what I mean? And we know that, you know, women, a lot of women who seek care from us for a home birth, it's because they have had traumatic experience in hospital. It may not necessarily be because of any physical so-called risk factor. It may just be because they've had inhumane treatment in hospital before, and they don't want that again, which is a perfectly valid reason for choosing home. I mean, home should be a choice. At the moment, it's not. You know, at the moment, a woman can choose an elective cesarean section but can't choose a home birth, and that's not right. So one of the things that we have to talk about when we have this argument, when we have these discussions all the time, is that, you know, this is a human rights issue for women. Also, you know, putting it into terms that that the government understands, supporting home birth for women is also a cost-saving thing for the government, because, at the moment, the biggest cost the health service has is maternity beds, women actually in maternity beds, postnatally. So there's all sorts of angles that we can be talking about, and I'm sure Alecia has tried all of these in her lobbying, to try, because it depends on who you're talking to as to what's going to give you the best. What they're going to listen to, I guess.
I think it's also concerning that that we're kind of creating these two tiers of midwives. I mean, I know when I studied at UTS and through the Bachelor of Midwifery, it was very much drummed into us that when we graduate, we're midwives, regardless of the setting in which we work in. And I think it's a bit concerning that we're creating this, these midwives are going to be eligible to be able to get the insurance and and these ones aren't because for whatever reason they haven't finished. A midwife is a midwife, and when we're registered, we should be able to work across all settings from the outset, with support, obviously, when we first start. But I find it really concerning that.
I think, Jo, so this is because I sit on ANMAC as well, that has been raised. And obviously from a consumer point of view, we can see how that impacts our ability to access private midwives. And it has been raised around a midwife, an undergraduate, graduating with prescribing and suturing and a whole range of skills. So she is right to step into private practice. The 5,000 hours is obviously a separate issue again, which is NMBA. But the NMBA is sitting on ANMAC listening to these conversations. So I'm not going to say it's going to be fixed in this year even, particularly because of COVID, but I actually have a good feeling that within the next 12 months, we're going to see a range of changes that will allow the longevity of private midwives and home birth in this country from that point of view. I know there's a lot of silos of and lots of other little bits of lobbying that need to go on to get us to a stage where it is about women and centered around women, but there are some obstacles that I think are going to be dealt with in the next 12 months.
That's great. And my last question for you, Alecia, is what can consumers and birth workers do to help move that along?
Yeah, I think definitely becoming politically engaged. So this is a federal government issue, so don't get confused with state and federal. Go and see your federal MP and ask for the Medicare report into private midwifery items to be accepted in full. Even just making that relationship. So I never ask for anything straight up. I get to know them, and so they know me. And then I'm quite happy. You want them to be comfortable enough with you, and I guess that you have credibility when you're asking them to do stuff for you. So they will go to the minister on your behalf and ask for all the things that we've been talking about. But when I started 10 years ago, we didn't even mention home birth. I mean, because they just switched off. It was very much around continued midwifery carer, and we would wear it close to home and things like that, or community based. Now though, we're past that. We've had some really good media. It's been talked about a lot. I think it's a lot more acceptable for MPs, even conservative ones, to hear. But if we don't get political momentum, and women and birth workers engaging politically, we don't make change. I mean, that's just the way it is. It's like the squeaky wheel gets oiled. So, yeah, I think, as you would be aware, I think in the last 2 years, we've had a lot more coordinated approach in this space that we're all, I guess, have got some commonalities that we've decided to work on. And I think that it's definitely helped progress things. I'm hoping, by the end of the year, we hear what's happening with the MBS stuff, because it's not, outside of home birth, there was other recommendations around increasing all rebates for antenatal and postnatal care. So, yeah, I mean, we've got, MCN's got free consumer rep training on the website, to give you a bit of a history of birth. just send us an inbox. I mean, I spend a lot of time in my week talking to women and mentoring them on how they can engage, and I'm available fairly regularly. So I think if we all took it upon ourselves to get a little bit more political, it would help make a difference.
Yeah, and that's something that we should do sooner rather than later. Let's not leave it until the last minute, again, December next year, before we start making noise about the insurance and the Medicare rebates. And like you said, that those changes to Medicare are going to benefit a lot of women, not just those who choose to home birth. So you can rope in your non-home birthing friends to get political as well.
Yeah, exactly.
Right. We've gone a little bit over time, but does anybody have anything they want to end on? Any comments from Joe and Teresa on the panel?
It's Teresa here. Just one thing. The college is of the understanding that as Alecia said, the MBS task force were very favourable of what was recommended, but our understanding is that now it's gone to the finance section of the government. So, and of course, unfortunately, the traction has been lost because of COVID, and there is a federal budget due in October. Who knows if there will be anything about maternity in it, but certainly, you know, we have lobbied for those recommendations to be taken up about the changes to the MBS items and the inclusion of home birth.
Thank you. Any last words from you, Joe?
Sorry, I was on mute again. No, I just hope that there's some really good consultation that happens between the ACM and the insurance company and privately practicing midwives and the women, the consumers that are using the services before anything's signed.
Yeah, and it sounds like that will be up to us as consumers and midwives to coordinate. So I think we'll get working. We'll start working on that very soon after this panel, so that we can make sure that everybody's voices are heard and all concerns are at least raised before it gets to government stage. Well, that's it. I think we've covered most of the questions from the people watching. And thank
Kristen,
you.
I did see, sorry to interrupt, I did see one about the ACT inquiry. It's probably
Yes.
outside of home birth, but what I was thinking, maybe if MCN runs a bit of like we might do a similar, to just discuss where things are at in a more general, because I don't know whether it's necessarily within the scope of today's.
Yeah, no, I agree. I think that would be a good one to have, definitely. Thank you all so much for taking time out of your day to answer our questions. Hopefully we see a little bit more consumer engagement now, and from midwives as well. So please feel free to contact us at Homebirth New South Wales or Maternity Consumer Network if you need some direction, if you're not sure what to say or what to do next. And stay, you know, if there's any petitions or anything going around, we'll both be sharing them. So yeah, I hope that this it seemed to answer some questions and raise others, but we'll try and coordinate some sort of consultation between the college and all of the people that are going to be affected by the product, hopefully this year, while we're waiting for COVID.
Thanks for organising, Kristen. I know there's Amy in the background.
Yes, thanks, guys.
Thank you. Thanks, everyone.
Thank you, everyone. That was really informative, and I think it's helpful. And thank you, Kristen, for running it, chairing the meeting.
No problem.
Thank you for inviting us.
Oh, you're welcome. If anyone would like to see the replay will be up on the Homebirth New South Wales Facebook page. So that will automatically, as soon as we cancel this out, that will automatically come up on that as well. So thank you, everybody. Okay, see you later.
Bye.
Bye.